Healthcare has gone digital, revolutionizing the way medical professionals interact with patient information and each other. This transformation has changed how we store, access, and share sensitive data, making information available at the click of a button. Electronic health records and instant communication tools have made care faster, more coordinated, and more efficient than ever before. But with these advances comes a critical responsibility: protecting sensitive patient data from new and evolving threats. Patient information is more than numbers. It's deeply personal, often containing details about our health, our families, and our lives. Its security is absolutely essential. Every digital transaction, from scheduling appointments to processing insurance claims, creates a potential vulnerability that must be addressed. Hackers and cybercriminals target healthcare data for financial gain, identity theft, and even blackmail, making robust security measures absolutely vital. Claims pricing software, for example, must prioritize data protection at every step, ensuring that patient details are never exposed or misused. A single medical claim can pass through many hands and systems, each one a possible weak point if not properly secured and monitored. Everyone involved, from front desk staff to IT professionals and software developers, shares the duty to safeguard this information at every stage. Trust between patients and providers depends on keeping data safe, secure, and confidential at all times. A breach can cause not only financial loss and emotional distress, but also erode confidence in the entire healthcare system, making patients hesitant to seek care or share vital information. As we continue to innovate and adopt new technologies, privacy must remain our top priority, guiding every decision we make. Protecting patient data is not just a technical task, it's a moral obligation that impacts lives and shapes the future of healthcare. The future of healthcare depends on our unwavering commitment to privacy, security, and patient trust. In the digital age, security is the foundation of patient trust, and protecting privacy is the key to a healthier tomorrow. The Health Insurance Portability and Accountability Act, or HIPAA, is a landmark law that transformed the way healthcare organizations handle sensitive information. Enacted in 1996, HIPAA was designed to ensure that patient data remains private and secure, even as technology evolves. It sets the national standard for protecting patient health information in the U.S., requiring strict confidentiality and security measures across the healthcare industry. HIPAA empowers patients by giving them control over their personal health data, while also obligating healthcare organizations and their business partners to safeguard it at every step. Protected health information, or PHI, includes any data that can identify a patient and relates to their health, treatment, or payment for care. When this information is stored or transmitted electronically, it's called Electronic Protected Health Information, or ePHI, and claims pricing software must comply with these rules to keep data safe. HIPAA mandates a combination of administrative, physical, and technical safeguards to protect health information from unauthorized access or breaches. Technical safeguards, such as encryption, access controls, and audit logs, are essential for any healthcare software, ensuring only authorized users can access sensitive data. Compliance is a shared responsibility, involving everyone from frontline staff to software developers, IT teams, and leadership. Security must be built into every layer of healthcare technology, creating a culture of vigilance and trust for patients and providers alike. Ignoring HIPAA isn't just a minor oversight. It can lead to massive fines, lawsuits, and serious legal trouble for healthcare organizations and their staff. The law is strict, and enforcement is only getting tougher as digital records become more common. A single data breach can cost millions of dollars in penalties, settlements, and lost business. The financial impact can cripple even large organizations. Worse, it can destroy a healthcare provider's reputation overnight. Patients lose trust in their caregivers and may hesitate to seek treatment. Many patients may seek care elsewhere if their data is compromised, leading to a loss of business and community confidence. The fallout isn't just financial. Victims of breaches face identity theft, fraud, and emotional distress that can last for years, affecting their lives in countless ways. Operational chaos follows a breach. Investigations, patient notifications, regulatory scrutiny, and costly corrective actions disrupt daily operations and staff morale. The human cost is the most important reason to take compliance seriously. Patients rely on us to keep their information safe. Protecting data means protecting people, their privacy, their dignity, and their trust in the healthcare system. Proactive security and compliance are far less costly than reacting to a disaster after it happens. HIPAA compliance is essential for stability, trust, and the long-term success of any healthcare organization. Security must be built into claims pricing software from the start. This is privacy by design. End-to-end encryption protects ePHI both at rest and in transit. Granular access controls ensure staff only see what they need. Audit logs track every access and change for accountability. Regular security audits and prompt updates keep software resilient against new threats. Comprehensive training helps staff use security features correctly. Technology alone isn't enough. People must understand and support privacy protocols. A strong partnership between software vendors and healthcare providers is key. Secure software and informed users create a culture of compliance. Where data is stored matters for security. Cloud-based solutions add convenience but increase risk by involving third-party vendors. On-premise software keeps ePHI within the healthcare provider's direct control. Local storage reduces vulnerabilities and simplifies compliance. Providers can manage physical and technical safeguards themselves. On-premise solutions minimize data exposure and attack surfaces. For organizations prioritizing security, local control is a clear advantage. The safest data is data that never leaves your secure environment. HIPAA compliance is just the beginning of building patient trust. Protecting privacy shows patients they are valued, not just data points. Strong security practices set organizations apart and strengthen the healthcare system. The right technology partner supports a culture of privacy and compliance. Secure, intuitive software makes it easy to do the right thing. Privacy is a cornerstone of ethical healthcare and lasting patient relationships. By prioritizing security, providers honor the trust patients place in them. In digital medicine, protecting health information is essential to doing no harm.